I don't know how many of the ones in the bucket work either.
There's copies of the agenda.
There was a contract sent out on,
Yeah, I saw that. I'm working on it.
I copied the front page so I remember that.
Yeah, I'm working on it.
Okay, I will not fester on it then.
Yeah,
I figured you'd be on top of it.
I think last time it was done was 2019. They sent me a previous copy because I was like,
No,
I don't have a previous copy. That way I can fill it out
start fresh.
correctly. Yeah.
Thanks for the cookies.
Yeah.
Thanks for the pizza, Shannon.
You bet.
And you would have to come and pass her a minimum file letter capital plan.
Good timing.
It was down in the, he was finishing something.
Oh,
Five down, the
Ryan's going Thursday.
Thursday, Friday.
Thursday.
Is Chip here? Do you know if Chip's here?
He is at the clinic.
Okay.
He should be coming.
Okay.
I haven't physically talked to him today. I'm
Okay.
probably gonna-
I saw him walk by.
Yeah, I mean, could he whip the pizza? I'm sure he could.
Yeah,
whip the pizza.
exactly, yeah.
Cause I didn't talk to him. I talked to Mary and Misty both today. So. It was money that probably.
No, it's dry out.
Yeah.
Right.
Oh, perfect, yeah. Oh,
Well, as to do this.
Whoever's here. Just send me down the line, yeah.
So then. He called them. He called it back.
So we have to sign our name first before you get your pizza.
He's, you're doing what I mean, you want, and also making it just like food stuff. I was like, I'm. So good. It's a day off. It's so, I didn't know we had. Got the Birkenstocks on. What's on this? 7:15 this morning. Oh, yeah. I know, it's like, I need the combination of you and. Exact combination. But also. Oh, my God.
GPS dropped off my stuff. I got no way of your model. That's cool.
So, Mondays. Well, then you go ahead and you're then I work. Love you.
I suppose pizza agrees with your golf thought.
See, and then.
Oh.
Not no, but I'll know.
Okay. Michael down.
Hi, Tim.
How's it going?
Good, how are you?
Good. This is Mallory. She's a
Hi.
practitioner student.
Hello.
Mallory.
Hello.
I know, that is going to. I knew that. I know, I thought I had a better day, like, yes, like, what's been out for me?
Really?
Huh?
You need wheels?
Like, months.
I do.
Like, I appreciate it.
I feel special much.
Here's mine.
Nothing. You need a pen.
Oh, thank you.
I think you have to.
Like, we can just, I think, does he have to sign in? If he's just
Eileen.
hanging out?
Observer,
Yes, that'd be great.
we count everybody.
Yeah, the same. It's all pretty. Not just something.
Got you in front of the owl, that's perfect.
I did that with last week.
No, I'm doing family fading away.
I guess.
Over bed. Valerie, how have you been doing?
I'm good, how are you?
Good, it was at our last checkup.
Yep, good.
I depend upon Chip to keep me upright.
We're gonna.
That's for
It's on the right side of the grass, right?
Things. I already. Oh.
Chip, you need it?
Yeah.
Oh, it's not. Oh, it's maybe. Not last week. Not idly sitting, but second. Someone just sitting on the floor, right? Yeah. As in the front office.
He came in and I left.
I think.
She started talking about that. later.
When do we get a roles process? Oh, that's something that's.
Sure, agenda. Thanks much, yeah.
Guess we'll call the meeting to order. I'll have around the introductions, Todd Devlin, Commissioner.
Christine Galtman, Commissioner.
Eric Cole, Administrative Assistant.
Chip Mitch, Health Officer.
Mallory Staples, I'm a nurse practitioner student.
Gina Stedman, tobacco education for Dawson, Prairie, and Weevil counties.
Eileen Eaton, Prairie County Health Department.
Dennis Teskey, Prairie County Commissioner.
Politowski, citizen.
Elaine Christopherson, Mayor. Or Prairie. Megan Calvo, Administrator of the Hospital.
Andrea Bybee, maintenance manager.
Welcome. Approval of minutes from December 17th, 2025. Entertain a motion. I'd make a motion to accept the minute. Do I have a second?
I'll second it.
Motion second on the floor. Any discussion?
What was the date?
17th of December. All in favor, say aye. Aye. All opposed, same sign. Motion passes. No special presentation, so we go to our county health officer, Chip.
Bill. Uh, influenza in Prairie County has been sporadic. But statewide, the, uh, the data ends on March 7th. So, I don't know what happened the last couple of weeks, but up until March 7th, there were 12,640 cases, 685 hospitalizations and 20 deaths. Uh,
How's that compared to other years?
it's, actually a little bit less. Uh, so I think overall it's more of a little milder flu season. We were kind of worried about that H3N2 subfake K, but never really came to pass. So, been lucky. 65% of the hospitalizations that were people 65 and older. 3% were from age 0 to 4, 17% were age 50 to 64. COVID, once again, it's been sporadic here. To year to date, there's been 2,500 cases in Montana, 149 hospitalizations and 9 deaths. Compared to 2020, there were 80,000 cases, 1,300 deaths. Significantly improved from that.
Herd. In my. Herd mentality or herd,
Yeah, generally viruses mutate to be more contagious but less virulent. So that it's not in their best interest to kill the host. They would die off too. So, uh, uh, so people don't get as ill with it. I mean, there were still 9 deaths. I mean, it's not
not,
totally safe, but comparatively, versus 1,300 deaths, it's significantly improved. RSV, there were 5 cases in the state as of the beginning of March, which was when my data ended. Pertussis, as of late March 2025, there were 140 plus cases statewide since 12/04, 22 plus in Missoula County. They had an outbreak in Fulton County, several cases. But still here, we haven't seen anything that I know of.
I'm sorry, but yeah, I haven't told you that, but yeah, we do have.
We do have some, okay, well, I'll leave that up to you to
Yeah.
talk about. Measles, 34 cases so far this year. Mostly Gallatin, Cascade, Flathead, Hill County, Yellowstone County, Lewis and Clark. Started April of 2025, Gallatin County had their first case after 30 years with none. That spread from that. Emerging diseases. Things that are kind of keeping our eye on is avian flu, bird flu. They had one severe human case last year, so kind of keeping an eye on it, but it's been fairly sporadic. Measles, we talked about. Monkeypox is still out there. There's a Candida auris. It's multi-drug resistant yeast infection. It's starting to pick up steam. Dengue fever, It's southern US is getting affected by it. It's an Aedes mosquito carries it. We don't see a lot of the Aedes here. Uh, but something keeping an eye on. Zika, same thing. There's a disease called Oripauchi virus. It's common in the Americas, mostly Central and South America, from biting midges. But they're concerned about traveling to the US. Something they're kind of keeping an eye on. West Nile virus, we're still in a high-risk area. Dawson, Prairie, Rosebud, Yellowstone are the highest risk areas in Montana for it. I think last year there were 14 cases or something, I think. And there's a metapneumovirus. There's another one that we're starting to see some of. Right now, California and New Jersey have had the most cases. It's a viral illness similar to RSV, but there's no vaccine available for it. Generally, last a week or two. Most people get over it, but they can cause pneumonia and meningitis and something. That's rare. Questions?
A little bit of everything.
Yeah, there's always a new disease. Got a handle on one, something else pops up.
Any questions for Chip?
Playing whack-a-mole. No,
You know, on the West Nile virus, is that mostly because of the Yellowstone? That water flow coming through a county, or is it just standing water? What do they contribute that to?
it's mostly mosquito borne. Culex mosquito tends to be the big one for that. We tend to see it starting more in the late summer, early fall. It's a little more aggressive. Mosquito, birds are the main vector or main transportation part of it. The mosquitoes bite the birds and get infected. Humans and horses are the ones who most likely get ill. 90% of people catching it have no symptoms or subclinical symptoms. About 10% have moderate fever, chills, muscle aches that last about a week. And 1 to 2% get severe virologic disease from it that can cause real issues. So
Do we still have a mosquito trap?
we do. At the fairgrounds, yes. And as at least last fall, they were positive that the stuff's out there. I think good news, most people have some resistance to it and probably have some clinical cases. There's some herd immunity. Horses get vaccinated for it. They can have severe disease and die from it. Dead birds are kind of a bellwether. Those we know is kind of going around.
Any other questions?
Stay inside, dawn and dusk. No, we're mosquito repellent, deep. Protect yourself.
Long pants and long sleeves.
Yeah. Also, the warmer weather starting to see more ticks out and about, so the concern is more for tick-borne disease now too, Rocky Mountain spotted fever and things like that.
Any other questions? Seeing none, we'll go on. Sanitarian's not here, Brant's not here, so
I'll just,
go ahead.
if I could just mention, Brand had emailed me and said that there was nothing new to report since the last meeting, so he didn't send a separate report or data sheet.
Okay. Thank you. Tobacco prevention,
So for tobacco prevention, we had our coalition meeting on March 4th. And we'll have our next one on June 3rd at noon in the basement of the Dauphin County Courthouse. I post on Facebook every Wednesday to the happenings of Prairie County. And I place an article every month in the Terry Tribune and an ad. I do that once a quarter. We only had one call in September to the quit line and no Clean Indoor Air Act violations this quarter. But they are doing T21 inspections are being conducted in Montana right now. It's where the law for places selling anyone under the age of 21 tobacco, it's a violation. So their federal laws prohibit the sale of tobacco products to anyone under 21. So they're doing compliance checks that are happening in Montana. The state retailer violation rate has doubled, rising from 8% in 2024 to 16% in 2025, making their enforcement, it's important that they need to enforce this because the kids are getting craftier, getting their items. I'm trying to get a time set up with the school so I can come in and do some presentations, and I got everybody these neat little water bottles. They're supposed to change colors from blue to purple, the closest I could get to the Terry colors for the schools. They just came in today, right when I was getting ready to leave, so I loaded them up in the truck. I have new chronic disease flyers for everybody here. They were updated and they covered Dawson, Fallon, Macomb, Prairie, Richland, and Webo counties. It's got everybody's information on there and the programs that everybody covers. I also have little flyers on the nicotine pouches. I had to order these separate because they didn't have any at the state level, so I got these in to hand out to school kids as well. And I'll have them like at the fair booth and that type of stuff. So if you need or want to look at some of those, you sure can. April 1st is our Take Down Tobacco Day. And then April 13th is Dawson's Board of Health, and the 20th of April is Webo Board of Health. And that's all I've got. Is there any questions? And I have enough if you want a water bottle too.
I'm for sure.
You want to, okay, whichever brochures you want, I can just pass them around. I didn't bring a whole lot of the nicotine pouch ones, but these ones are the chronic disease. It has all information that you need to get a hold of any of us. And then I only got 4 of these, so I can give 3 of them out if you want the nicotine ones.
You can not call me.
I want to take one to the school and show the counselor and when I stop there. So I have more. I just have them at home. They're at the office. There's another one of those too. Anybody wants one of those? I'll give it to Eileen, thanks. And she needs to get in last time. We have noticed their increase in the pouches being used. They're easier to hide. Instead of the vapes, there's no vape, so you can't tell that people are using them. And the kids are, instead of throwing them away, they'll stick them under the desk or use them like back in the day, we used to throw spit wads at people and now it's nicotine pouches are stuck on the ceilings and walls instead. The kids instead of using just one pouch at a time, they'll use several, so they get a bigger hit of nicotine. And at their last meeting, one of the people said that they have heard that the kids are breaking them open and then snorting the contents of them now, which it says on the packages, do not consume. And
Burn their,
yeah, they're not gonna have any sinuses left, but, or they'll take a pouch and they'll put it in their drink.
Hmm.
So,
It dissolves.
no,
it
it just adds to the drink, but they don't dissolve,
could
because
be like a tea leaf.
pretty much. Cause it's still that little pouch, cause you can have the pouch in your mouth for an hour and it doesn't dissolve, you have to actually get rid of it. But some of the kids will, to hide it, they'll swallow it, which isn't good either. It's pretty gross.
Any questions? Go on, public health and Tylene.
For my flu update, so far we have only 2 positive flu cases. Which means those are people that have gone in and gotten tested and the test showed up positive. One was a pediatric and one was an adult. I've given a total of 43 flu shots for this year, and I don't foresee giving any more. Just because it's getting to be March and spring and to not vaccinate for the flu until next September, October.
Did you have a turnout for a
Flu shot? Yeah, I reported last time that, my flu shot clinic, I think I did like 20 people.
Yeah.
So it's pretty low, just because you can get a discount on your groceries if you go down. And then next up is this is the lab specimen transport protocol that I gave everybody on the health board a copy of. Hopefully you read through it and know if you have any roles or responsibilities. It just explains basically if there's a biological agent of some sort that has contaminated the water, which would be a DWS kit that we would use to test the water, or chemical biological agent threat kit is a CBAT kit. All those kits I have stored in the blue storage shed. And they give directions on how to obtain samples. The protocol has phone numbers as to the contact information for like the state's lab courier, the epidemiology section, public health emergency preparedness, as well as our own county numbers such as DES, public health, the sheriff, the hospital, and as well as the shipping agencies too, like FedEx, UPS. Those would be people that might be involved if we have to transport materials. But usually we try to use the state courier to transport things, but you can also use UPS and FedEx to transport things as well. You just have to be sure that you collect it correctly, package it correctly, and put the proper labels on. And so that is what a lot of this explains. So I'll be collecting signatures from, I think, Todd, and I think you and you, I need signatures on it, on the checklist that I have. Get that from you after the meeting.
Okay,
And then I did do oral injuries activity at the school January 22nd. There were 50 students that attended it from grade 7th through 12th grade. I gave a PowerPoint presentation showing giving data on the injuries and as well as showing pictures of the type of things that we use to protect our oral face and head with like mouth guards, helmets, face masks, those type of things. I also showed samples of different mouth guards and the cost of those and gave a pre and post test to test how much they learned from the presentation.
What they're paying attention or not.
Yeah, I have to. Yes, it's part of my grant. Yep. I also did a highly infectious communicable disease tabletop. We held that at the hospital conference room on March 4th. And we had a good turnout. It's a regional tabletop that is held virtually. So you go on this Zoom meeting basically or a Teams meeting and so different jurisdictions like Rosebud County, Powder River, Custer County, I think Treasure County, Macomb County, Prairie County, all of us that are in the eastern region participate in this tabletop together. So it's good to do because it kind of reminds you of your roles and responsibilities of what you need to do during an emergency of a communicable disease. It was again measles, which we did last year as well, but they tried to do it at a higher level, which involved like people from Canada that were part of a choir. And I know it seems silly, but trust me, during COVID, there was some silly stuff that went on that I would not have thought of, that like really weird scenarios that you would have never anticipated that happened. So it was interesting. The thing that was hard was, okay, they're from Canada. Some of them have acquired measles infection. Does Canada have to take them back, or are we forced to have them, to keep them? So someone from the state looked it up. Yes, Canada will take them back and they can continue their isolation at home in Canada instead of us trying to house them here. Because then we were talking, do we then get hotel rooms? Because then the people that are exposed, it's a 21-day incubation period. Are we going to house these people for 21 days? So
Rent the town.
yeah, so it was a good scenario to discuss, but in the end, we realized, we found out, yes, we can just send them back home and hopefully discourage them from going to the next state to continue their little choir concert series. So that was that. Other updates. There was a measles case reported in Blaine County on the 9th of March. There was a public exposure on the 6th at the Fort Belknap High School facility, so I'm pretty sure that was during basketball tournament. The person was not a Montana resident, so it was not reported on the measles website in Montana. But it did not give the information as to where they were from. RSV, sorry, Chip, I was terrible about not contacting. It's not a reportable disease, but it's just, if there's an outbreak, then the state wants you to fill out an outbreak report form. There's 4 cases of infants/toddlers in our county as of the 16th of March. Like I said, it's not a reportable disease, but if there's an outbreak, then they do want to be able to send a report. So I got that done. So it's kind of weird that they don't, like, we have a vaccine for it and stuff, but they don't want, but it's not a reportable disease. There's no isolation parameters that you have to
No.
encourage people to do. Or
No
anything.
protocol.
But it's not a reportable disease. So
Yeah, but it's got a vaccine for it.
I know
That's weird.
it is weird. So we did our best with it and I helped the people out the best that we could with it, so. Everybody's been pretty good about it. About letting me ask them questions, so. That is what I have on that, and then I can give the school report if you are okay with that.
Good to go.
Okay, Megan sent me this, school report. Sand Creek Dental came and did dental screenings for grades K through three on March 13th. And I had told you about, me coming and doing an oral and facial injury prevention assembly with the secondary students in January. Jimmy, head of maintenance, is getting his permanent drinking water license next week so he can continue to test the drinking water in our buildings. Early childhood screening, that would be, used to be called preschool screening, is next Thursday, March 26th. Encourage families with young children to sign up. This is for babies through pre-K children. The school is continuing to update our emergency plans and will be reaching out to the county soon as we begin working on the emergency shelter portion of it.
All done?
Yep.
Okay,
Sorry about that.
that's all right. Any questions for Tylene on public health issues? Seeing none other business? Need to set a meeting date?
It's usually June. Seventeenth.
Where we at?
June 17th, possibly.
Yeah.
That's a commissioner day, so that was.
Is it? Okay. Does that work?
Until we find out differently.
Right. Okay.
We got county districts coming up and they don't have them solidified yet.
Okay.
They're usually the
Better
first.
work.
Okay.
Does that work for everybody, 17th?
You don't know.
Entertain a motion to adjourn.
I'd make a motion.
Got a motion, need a second? Come on, guys.
Doesn't give somebody
You
else.
three.
Huh?
It's just you three. The other two
I'll
aren't here.
second.
Well, hog on.
Discussion, seeing none, all in favor, say aye. Aye. Motion passes.
Thank you for lunch, Tylee.
Yeah.
It's always the best.
Yeah.
And Christine has cookies.
And how do you know you don't eat it?
I used to. It was really good then.